Most people don't know. The evidence today that fluoridation actually works systemically is very weak indeed. In fact, the Center of Disease Control, which promotes fluoridation in the United States, says the predominant benefit of fluoride to fight tooth is topical, works on the outside of the tooth. Well, once they conceded that, this should have been the end of fluoridation. The idea of swallowing this stuff, I mean, it's medical madness. Think about it. If you put a medicine, which is what it is, if you put a medicine in the drinking water, you can't control the dose. Oh yes, you can control the concentration at the waterworks, yes, but you can't control the dose because you can't control how much water people drink, and you can't control how much fluoride they're getting from other sources. So you can't control the dose. Secondly, once you put it in the water, you can't control who gets it. Everybody gets it. Bottle-fed infants, young people, old people, sick people, people with poor nutrition, people with iodine deficiency. It's madness. If you ask a pharmacist, you say, is there any drug in your store? Do this, please. Ask a pharmacist, is there any drug in your store that you can give to people and say to them, don't worry about the dose, take as much as you want? And is there any drug that you can give to anybody? And is there any drug in your store that has no side effects, other than this blemish of dental fluorosis? They look at you as if you were mad. Try it.
多年，造成家庭经济困难，生活简陋，终有患者中。
Well, here's the story. You know, we're slow learners. For about 100 years, the phosphate fertilizer industry damaged the vegetation and crippled cattle in the area of their plants because the process involves digging up the phosphate rock, which is insoluble in water, no good for fertilizer. So you heat it up with sulfuric acid. This drives off two very toxic gases, hydrogen fluoride and silicon tetrafluoride. And as I say, for 100 years, these gases decimated the vegetation, the cattle grazing on the food and so on, citrus groves in Florida. And then after 100 years, they were forced to put scrubbers on. It's a spray of water. And that spray of water converts these two gases into a substance called hexafluorosilicic acid. And this scrubbing liquor is circulated through the system until it's about 23% concentrated. And that scrubbing liquor, which contains all kinds of other nasty stuff, toxic substances, that's what's put into tanker trucks and ends up in our drinking water.
Well, sure, it's a hazardous waste.
If it's going into the teeth, could it be ending up anywhere else in our bodies?
Absolutely. Once you drink it, it can go to every tissue in the body. And one tissue there's no argument about is the bones.
有患者中。
About up to 50% of the fluoride that we take in each day is excreted through the kidney, so we get rid of it. But the other 50% or so accumulates in our bones
有患者中。
over a lifetime, and even more so if you have poor kidneys. And young children apparently absorb more fluoride into their bones. So the question then is, well, what's it doing to the bones? The first symptoms of fluoride poisoning of the bones, which we know from India and China, where millions of people have fluoride poisoning, is just like arthritis, stiffness of the joints, pains in the joints, pains in the bones. And as it accumulates still further, now we're talking 50, 60, 70 years of living in a fluoridated community, your bones get more brittle. They get harder, but more brittle. And the big concern there is hip fractures. But my biggest concern, as far as health is concerned, is what's it doing to our children's brains. Because when the baby is born, they're very fragile. They're much more sensitive to toxic substances. We don't think the blood-brain barrier is fully formed at birth. And we now have 24 studies, most of them from China, but one from India, one from Iran, one from Mexico, which shows an association between moderate exposure to fluoride and lowered IQ in children. And I ask you, what parent in their right mind would trade a saving of a small amount of tooth decay? You know, the best study in the United States shows a saving of 0.6 of one tooth surface out of over 100 tooth surfaces in a child's mouth. That's the best that they've done, 0.6 of a tooth surface. Would a parent in their rightful mind, if they knew that the risk was possibly lowered IQ, lowered change in mental development, I mean, it's crazy. No one would do that if they knew, but the trouble is, most people don't know. Most people don't know.
有患者中。
I sometimes think that dentists see people like a gigantic mouth with little legs on it. I mean, they're so focused on teeth. It's teeth, 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 teeth. And if you look at the studies done in Canada, not many studies, but they're all on teeth. Teeth, teeth, occasionally one on bone, as if teeth were the only tissue in the body. The dentists seem to forget that we have brains, we have endocrine system, we have bones, we have kidneys, we have all these other
部
tissues that we
门对
should be
饮用
concerned.
高氟水的16839人进行检查，查出氟斑牙4960人，腹股症327人，有的甚至瘫痪。